Hi, my name's Todd Vaughn. I'm a physical therapist. I've been practicing for 30 years. There's always kind of some confusion as far as what is vertigo in terms of dizziness versus just loss of balance. So those are really three distinct types of things. And we're definitely screening the musculoskeletal system in terms of all the components that are related to balance, and that's our vision, that's our somatosensory system, that's our receptors in our joints and in our muscles that kind of tell us where our body is in space, and then our sensory system in terms of when we're having contact with surfaces, that feedback is important to our neurological system, and of course the inner ear. So the inner ear is distinct in that it creates a sense that things are still moving when they're not. So that's a particular type of problem, and we term that vertigo, which a lot of times patients are coming in thinking they got vertigo, but oftentimes it's related to some other kind of impairment. Vertigo has a specific type of treatment, and we screen those when they come in, and then certainly if they need that type of intervention, then that's what we're providing. There definitely is a trigger, so we're always spending an extensive amount of time going through their history and trying to figure out what that trigger is. There's 3 canals in our inner ear, and based on a particular issue with a particular canal, they're going to be motion sensitive as far as moving their head a certain direction. So, were they rolling in bed when they had the issue? Were they looking down and then getting up? Did that cause the issue? Or were they, at their hairdresser with their head back over top of a bowl, working on, washing their hair? Was it something in particular that caused it? There's lots of predispositions. Certainly head trauma is one. There are certain medications that can loosen these crystals in our inner ear that can cause them to dislodge and get in these canals and create issues. So we're always just trying to figure out what it is that was the trigger, and then, through that comprehensive history and the testing, we can figure out which treatment to apply. We do see a lot of older folks with that kind of problem, but I would tell you, kids that had head trauma, that definitely can dislodge those crystals, and certainly concussions. Kids that are having concussions can have these kind of symptoms. So contact sports, soccer, football, basketball, a lot of people hit their head on a surface, and it can really create those kind of issues as well.